He and Lizzie are here today with geneticist Dr. Brandon Colby for some test results. We're going to reveal them in just a minute. So, Dr. Colby, how in the world can you thoroughly analyze on genetics whether or not people are compatible?
We do this by looking at immune system genes. And it seems like long before Match.com, our genes actually had to find a way to pull people together that were likely to have a healthy child.
The science behind this is the idea you're looking for somebody that's actually different from you, right? More of a variety of genes, that kind of hybrid vigor. If you sort of mix up the genes, you're going to have a stronger individual.
That is exactly correct.
Survival of the fittest.
So, Dr. Colby, based on genetics, are they sexually compatible?
According to your genes, you guys are actually extremely sexually compatible.
And so, Joaquin and Lizzie, we're going to have a little fun with you. We're going to bring these apples and oranges together. Sexual compatibility, you guys are right together.
And that's
an apple and an orange.
Yeah.
Right. And Lizzie, I actually looked at your genes a bit further, and you're actually much more likely to reach orgasm with Joaquin, especially around the time of the month that you're most fertile.
Whoa.
See that?
You know, I think we just moved those. There we go. But you can also look at the possibility of how their kids will turn out based on their genetic makeup. And what info did we find out on that front? For
athletic performance, once again, you two are a great match. And you could slide those apples and oranges together because for athletic performance, it seems like your children are going to be predisposed to excelling at endurance-based sports and activities, things like cross-country skiing and marathon running. You both have a gene that if you pass that down to your children, and it's very likely that you're going to, your children are going to be able to see the proteins in breast milk as super brain food, and on average, it's likely that they'll gain about 7 IQ points just from breastfeeding. Now, looking at both of your genes, Joaquin, I'm going to start you on a low-sodium diet because you're predisposed to high blood pressure with salt intake. For Lizzie, you have a gene called ITGB3 that increases your risk of early onset heart attacks. And through simple interventions, we're going to work to actually prevent this from affecting you. Okay. And the great news is that armed with this information, we can now protect your future children against these diseases as well.
Okay.
Yeah.
Thank you.
And the reason that we have you here today, and this is so important for everyone at home, this is about outsmarting your genes. I remember on the show we did genetic testing, and it said I was at increased risk for heart attack and diabetes. But you know what? That's where lifestyle comes into play. We can outsmart our genes. And you know what? You guys can start making healthy decisions today, not only for you, but your future children. Thank you so much for being here.
Thank you.
Thank you, Dr. Colby. And as far as Dr. Colby, he has his book, Outsmart Your Genes.